Sleep apnea is a very prevalent disease that occurs especially while sleeping. The patient stops breathing. When he stops breathing, there's gasping. If there's no breathing, definitely is going to probably wake up the patient. Okay, so the patient has what we call like micro arousals during the night, and he doesn't realize what's happening. It's the partner or somebody near to the patient that is seen. Usually there is snoring, and on top of having a lot of snoring, okay, that could be very intense, there's also that period of pause of breathing that is seen by another person. Most of the patients that have obstructive sleep apnea do not realize what's happening. Therefore, it goes completely undiagnosed. And therefore, that's one of the major problems that occurs, because the person does not realize that it's happening to them because they're asleep all the time. But sleep apnea is very, very dangerous, because if this occurs every single night and many times during the night, it means that we're not getting enough oxygen into the blood. So the way I always explain the way it works is that the obstruction occurs at the level of the throat. Okay, so it's an upper airway. So, and that obstruction, there's a collapse of the airway. If there's a collapse of the airway, then there's not enough air that enters the lungs. If there's not enough air that enters the lung, there's not enough oxygen that reaches the blood, and therefore the first organs that start to suffer are the heart and the brain. Symptoms that the patient presents usually might be very mild. It varies between patients. However, usually patients are very, very tired during the day. They feel like they have not slept. They feel many times when they wake up in the mornings, they have morning cloudiness. They're not able to think well for a while. Also, they might have morning headaches. They feel extremely tired or sleepy during the day. And also they might have some mood changes and memory loss. These are daytime changes. During the night is that they feel they need to go to the restroom many times, or suddenly they wake up many times during the night, and they might even feel that they have a loss of breath, that they cannot breathe, they're gasping for air. The risk factors for sleep apnea are, first of all, being male. Okay, men are much more frequently prone until a certain age with women. Women in menopause equal males after menopause. Also, nasal congestion is one, because if you can't breathe well through your nose, you're going to open your mouth, you're going to snore, you're going to have more problems of obstruction. Also, the use of sedatives, sleeping pills, also alcohol is a predisposing factor. And of course, we tend to look like our parents. Usually there's a tendency of snoring, and it comes from our parents or our family. That's family predisposition, of course. So sleep apnea can be diagnosed, okay, first of all, through a family member or recording. But it's true that we need to have a sleep study. So there are many types of sleep studies that could be done, but a formal sleep study is done in the hospital. But also there are sleep studies, there are what we call home sleep studies that could be done to have a knowledge of what's happening. Many times, one of the most important things that I find is that there are many surgeons out there that usually do not do any type of sleep studies. And sleep study is important. We need to know different parameters that are going to give us information of what's happening during the night. There are many types of treatment, but one of the first measures that we have to do, first of all, is probably changes in lifestyle. First of all, losing weight is pretty necessary, I would say, in a great amount of patients. The other thing is the use or avoiding the use of sedatives or alcohol. Also, I would say diet restrictions might be helpful, especially to sleep better. But also, of course, there is the use of what we call CPAP. CPAP machine is continuous airway pressure. It's a machine where you use a mask that's connected to a hose with the machine, that's going to give continuous pressure, which is going to splint open the airway in order to make the patient breathe adequately and the oxygen reach the lungs adequately. Other options that exist, of course, are surgery. Surgery is done in specific cases, and those cases have to be very, very, very well analyzed. And one of the things that we do for to know if surgery is adequate is the use of what we call drug-induced sleep endoscopy. Drug-induced sleep endoscopy is an endoscopy. We look inside after giving the patient medication that will put him to sleep, and once he or she starts snoring, we're able to look inside to see where and how the airway collapses. There are other types of treatment like mandibular advancement devices that can be used also in certain cases. As I said, surgery, there are many types of surgeries. There is surgery for soft tissues, surgery for hard tissues, like the bone, and also there's hypoglossal nerve stimulation, which is something that is very, very new, that is actually able to move the tongue forward by electrical stimulation. ENT specialist in sleep apnea is a person who has been trained, who has studied, and also has the possibility to actually look at the upper airway where the problem is. I think that at this moment there are many specialties that are involved with sleep apnea. There's pulmonology, which is we work together with them. There are also dentists that are doing a lot of sleep apnea diagnosis at this moment. But I think there is a need, to integrate two other groups for a complete evaluation and the adequate treatment for the patient, and not let the pulmonologist, not let the dentist or any other specialty work alone. We are the ones as ENT specialists that are able to see and have knowledge of the upper airway where the problem is.